How many times can you call the bomb squad to your house for a suspicious package before you get charged for a misuse of emergency services? Turns out the answer is 3. That is one of the many things I learned when I was sworn in as the 19th Director of the United States Centers for Disease Control and Prevention. It was a job I never aspired to or even applied. See, we were in the middle of a historic pandemic. Nearly 4,000 people were dying every single day. And as we say in infectious disease circles, a pandemic is something you prepare for, but never want to experience. So why did I take the job? Well, throughout my career, I've had one guiding principle, and that is people matter. And how we treat people in their darkest moments and in ours defines who we are. And today I would even add caretakers matter, truth seekers and truth tellers. Today, perhaps more than ever. There's a quote that's written into the walls of the United States Department of Health and Human Services by Vice President Hubert Humphrey. And it reads, "The moral test of government is how that government treats people in the dawn of life, the children, those in the twilight of life, the elderly, and those in the shadows of life, the sick, the needy, and the handicapped." And that, for me, in a sense, says it all. I was poorly prepared for how unrecognizable my life would become when I joined the CDC. That I would be traveling with a full-time security detail, that I would have credible threats against my life, like the package in March of 2022. How did I even get here? See, I always knew as a child that I wanted to be a physician. I loved science, and I loved math, and I loved people. I had a pediatrician by the name of Dr. Judith Osha. And only recently did I recognize Dr. Osha's rarity in her field, her prominence, that she had roots at Harvard, that she was a pioneer for women in medicine. At the time, I just saw in Dr. Osha the possibility of myself in her career. I saw medicine as this perfect bridge between intellect and empathy, between EQ and IQ, and I tried to bring that with me wherever I went. I started medical school at Johns Hopkins, and during that time, I suffered from pretty severe imposter syndrome. I remember calling my mother the night before my microbiology exam in a complete panic that I would fail. And I remember that this troubled me so that I took a detour through the hospital the morning of my exam so I could go to the newborn nursery and peek through the window and see the babies. And I immediately calmed down. This is what matters, people. That imposter syndrome followed me while I was a resident at Johns Hopkins, and I tried to do the same thing I did in medical school, just focus on the people I was there to care for. One of my earliest patients was a young woman by the name of J.M. She was suffering from a rare, severe, and yet undiagnosed autoimmune disease. And I remember J.M. because she terrified me. I was scared for her, but I was also scared for me because I didn't know what I was doing. And I remember I did what I could. I sat by her bedside. I listened. I held her hand. I was a resident in 1995, and the thing that was raging through the city of Baltimore at the time was AIDS. The fear was so rampant that the United States had actually banned people with HIV from coming into the United States. And I was caring for patients with AIDS. They were young, and they were reduced to the frailest versions of themselves, and we had nothing for them but our bedside care and our compassion. Until December of that year, I remember the FDA finally approved the third drug of what became known as HIV treatment, the cocktail. And we could finally look our patients in the eye and say, "You just might live." And it was then that I decided I wanted to go into infectious disease, not just because the medicine and science was moving so fast, but because of some of the patients I was caring for who were too often left behind by stigma, by high costs of care, by bad policy. And it was then I decided I not only wanted to be at the bedside, but I wanted to understand the larger forces in healthcare. I wanted to be both bricklayer and architect. And so I pursued a master's in public health. And during my master's in public health, I learned to quantify risk and downstream cost. And I learned how to manage uncertainty. How do we make decisions when the data are unclear? And this tool came in really handy 2 decades later during COVID-19. And we use these tools in health policy because I had a North Star throughout my career, and that is even when data were uncertain, people matter. And my colleagues and I use this with every public health fight we waged. Fights like increasing the amount of HIV testing that was happening in the United States. See, the stigma against HIV wasn't just cruel, it was preventing people from getting tested, and it kept infections spreading. At the end of last century, a third of people who had HIV in the United States didn't even know they had it. And so my colleagues and I projected the downstream costs and life expectancy and impact of what would happen with more HIV testing. And we published this paper. And we and other colleagues did work in this area, and I was so proud the next year when the United States changed its HIV testing guidance. Another fight was to reverse the long campaign of not allowing people with HIV to enter into the United States. And I remember a policymaker, I won't say who, calling me on the phone and saying, well, Rochelle, how much is it going to be to treat all of these people? And I knew the answer, and I gave him the answer. But I also said, you don't ask that of anybody else coming in. At least we didn't at the time. Another fight was the fight to decrease drug prices and to expand the use of generic antiretroviral therapy because generic therapy was so much cheaper than the brand name alternative. And that meant we could treat more people and faster. See, behind every price tag, expensive price tag of a medicine, is a patient out there who is trying to access life-saving care. And how we treat those people matter. And that's not just an idea for me, it's been a guiding force. Like in 2016, when Dr. Robbie Goldstein and I were on clinical service at Massachusetts General Hospital. We were taking care of an elderly gentleman. He had metastatic tuberculosis, and we were at his bedside for weeks. And ultimately, the gentleman passed away, and Robbie and I were crushed. And so to cope, I turned to a personal practice and to try and put some good in the world in a really bad day. And I invited Robbie to give blood with me. I can't, he said. I was stunned at my own insensitivity. I knew Robbie was gay. I adored Robbie and his husband. I had forgotten, or maybe I never fully realized, that there was an old, outdated policy that prevented gay men still from donating blood. I donated blood that day, and Robbie sat by my side. And we committed ourselves in that moment to another fight. Weeks later, a gunman opened fire on Pulse, a gay nightclub in Orlando, Florida. 49 people were killed, and 53 were wounded. And gay men showed up in droves to donate blood in solidarity. And they were all turned away. Robbie and I continued our fight. We wrote, we spoke, we lobbied, we advocated, and we pushed for the evidence to demonstrate that it was, in fact, safe now for gay men to donate blood. And 7 years later, in August of 2023, Robbie and I finally donated blood together. It was a moment of justice that was long overdue, but it wasn't the only crisis we faced. See, in March of 2020, I was chief of the Division of Infectious Diseases at Massachusetts General Hospital, and that was the month we had our first 2 cases of COVID-19. What followed was the most harrowing year of my life, and I suspect that is true for many of you. Patients died alone. Surgeons postponed much-needed cancer resections, and clinicians were overworked and overwhelmed and afraid and uncertain. And I had the great privilege of standing among some incredible heroes who were working on the front lines, leading and treating and guiding public health messaging and helping to interpret an ever-evolving science. And that's when I got a phone call, completely unexpected, from the Biden transition team asking if I would consider leading the CDC. And all those imposter syndrome demons, they came rushing right back. How could I possibly do this impossible job? Now, erase the image that you have of the majestic flags and the ceremonial swearing in. It was COVID. I was sworn in my living room on Zoom. Nothing I learned in medical school could have prepared me for the landmines that lay ahead, for the dozens of press conferences where we were working to inform the public and stay ahead of the tidal wave of mis and disinformation, for the 17 heated hearings where I was testifying in front of Congress. But it's like they say, a pandemic is something you prepare for, but never hope to experience. Now, I was still a doctor, of course, and after one of those particularly difficult days in a late-night flight leaving Atlanta, I got the call that no doctor ever wants to get on an airplane. Is there a doctor on the plane? Several rows back, there was a passenger in distress, and I was the only one who stood up. She needed medical care, and I was there. But even on those really impossible days when I couldn't seem to get a break, there was somebody out there always reminding me right when I needed it most that I mattered. I came home one day to a third grader who had baked me a cake the day she got her COVID vaccine. A colleague of mine texted me from across the country on a Sunday just saying, "Hang in there, Rochelle, you matter." Or a neighbor of mine who left on my doorstep, literally, Rochelle rocks, painted rocks with my name on them. These small gestures were enough to fill my tank and propel me forward. And they reminded me there was no room for self-pity, not when so many other people were doing extraordinary things during this time to help others. And I knew there was no way I could repay the kindness, so I did my best to pay it forward. I asked my staff at CDC to give me the names of 5 people a week, 5 people I called unsung heroes, people who were doing extraordinary things but out of the spotlight. And I did my best to call every single one of them just so I could hear their inspiring stories. I talked to somebody who rappelled out of a helicopter to drop COVID test kits on a cruise ship at sea. I spoke to somebody who had stayed up all night booking flights for a massive CDC staff deployment. And I spoke to somebody who had knocked on doors, going door to door, doing health surveys after a train derailment had emitted toxic fumes. Almost none of them had spoken to their CDC director before, and I was there to just say, "I see you, I value you." When I look back on my time in government service, those hard days are kind of all just a blur. What I remember most is those moments of human connection. That's what stands out to me. Like the time that Robbie and I donated blood together. Or the day that JM, remember JM, my patient from Baltimore? She saw me on CNN and she emailed me 25 years later. And she said, "Hi, Dr. Walensky, do you remember me? It's JM." As if I could ever forget her. You came back. You always came back. Doctors don't always do that. See, after the prescriptions and the paperwork and the email is all done, what people remember is how you treated them, how you made them feel. Which brings me back to the bomb squad in March of 2022 at my doorstep. See, it turns out that there was a simple explanation for this mysterious package that landed at my doorstep. It was chocolate-covered pretzels and pound cake, sent from a grateful passenger I had helped on an airplane several months prior. Many people have asked me if, after all of what I've learned through the headlines and the hearings and the testimonies and the exhaustion and all of this missed time with my family, would I do the CDC job again? Helping to lead the nation's COVID-19 response was never part of my plan, neither was government service. But as every doctor knows, when a patient's life hangs in the balance, our plans don't matter. You answer the call. And when the lives of a nation hang in a balance and you're called to serve, we serve. We run to help people, to stop the bleeding, to stabilize, and to give people hope and a fighting chance to come back stronger. That's what doctors do. And when those who attack science, we serve. And when those who are attacking the truth seekers who traffic in truth are called, we serve. Because in our darkest moments, how we serve one another, how we treat one another, is ultimately what defines us. Thank you.